Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genier Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Elena Aslanides. That is a toughy name you got there, my dear. Okay, but it's very pretty.
Thank you.
Suicide and Community Response Communicator, and Justina Gorman, Coalition and Community Development Coordinator, both with Stark County Mental Health and Addiction Recovery Board. Good morning and welcome to the show, ladies.
Good morning. Thanks for having me.
Mental Health Awareness Month has been observed in the U.S. since 1949. Every year during the month of May, our goal is to raise awareness about mental health. It's an opportunity for all of us to come together and remember the inherent value we each hold. No matter our diagnosis, appearance, socioeconomic status, background, or ability, we want every person out there to know you are inherently worthy of more than enough life, love, and healing. Showing up just as you are for yourself and the people around you is more than enough. This morning, we're happy to share this time with Elena and Justina from Stark County Mental Health and Addiction Recovery, a multifaceted county behavioral health board comprised of expert professionals, dedicated volunteers, and concerned community leaders. Stark County Mental Health and Addiction Recovery believes in hope, wellness, and recovery for everyone. We'd like to remind our listeners that our program today is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
Elena, welcome to the show. Please introduce yourself and tell us, listeners, a little bit about yourself, your background and training, and the work you do at Stark County Mental Health and Addiction Recovery.
Good morning. Thank you again for having us. So, Paul, as you said, my name is Elena Aslanides Kandis. I'm a licensed mental health clinician. I have been practicing here in Stark County. We've been working in Stark County for about 5 years now. And previous to that, I provided direct service in Summit County for about 11 years. Suicide prevention is something that's always been kind of at my heart. From the time I was in 6th grade, I had a peer that died by suicide. And that was kind of I think the beginning of the world for me. I didn't realize at the time that how much that impacted my life. And so now all of the work that I do for Stark MAR is related to preventing suicide, helping our system know how to intervene when somebody is at risk for suicide. And then when a loss occurs, especially the work with our schools is how are we responding to help our youth to prevent suicide as well, because a big piece of what we call postvention is that aftermath from a loss is prevention.
And so, Justina, welcome to the show also. Please introduce yourself and tell our listeners a little bit about yourself, your background and training, and the work you do at Stark County Mental Health and Addiction Recovery.
Thanks, Paul, and good morning. And like Ellen said, thank you again for having us. I received 2 master's degrees from Walsh University in both school and clinical counseling. Basically ended up taking those degrees, and I worked as a school-based mental health therapist for 3 years. I was out at Glen Oak High School, but I worked for child and adolescent behavioral health. After that, I came to Stark MAR and am coming up on about my 5th year as the Coalition and Community Development Coordinator, which really involves implementing system-wide initiatives in both substance use prevention, treatment, harm reduction, and recovery, primarily through my coalition, Drug-Free Stark County, and my task force, the Opiate and Addiction Task Force. Unlike Elena, substance use has not really been my passion, but once I got into it, this world, the prevention world, the treatment world, recovery, the harm reduction, there are so many passionate people, and my colleagues just help me keep going every day. I mean, we definitely deal with some difficult stuff, but it's just amazing work that we continue to do, and both of us are just trying to save lives.
Wow. You have a program called Safe Home. Can you explain that to our listeners?
Absolutely. So creating Safe Home really involves protecting your family from various risks. And probably when we say that, people may initially think of like protecting their families from different kinds of accidents or attacks. But this campaign is really designed to increase people's awareness of different types of risks in their homes, and really understanding the warning signs of substance use and suicide.
I try to relate this to, when you have young children in your home, we think of that as childproofing our homes. It's to help remove some of the risk just in case. We never know what's going to happen. And so this is kind of the same concept as always ensuring that our home, we're reducing as much risk as possible.
Substance abuse and suicide were mentioned. What do you mean by substances?
Yeah, substances is really more of a general kind of all-encompassing term that can include alcohol, medications, both prescription and over-the-counter, household chemicals and cleaners, and more.
So you aren't referring to actual drugs as many of us would define them. You're talking about maybe products that produce an aromatic odor, something. When I was in the military or in the Army, some of these fellows that were from a certain state of the Union began, because they couldn't get their normal drug usage, they started sniffing aerosol sprays, had a very human-esque odor, if you will, and it did put them down. So that's the first time I have run into this kind of thing going on.
And that can absolutely be included when we talk about substances.
Mhm.
And I know many people, especially with, what we have going on in the world now, when we say substances, might think of like fentanyl and cocaine and the opioids, just in general with the crisis that we're experiencing. But for the focus of this campaign, we're really trying to focus on the items that are probably more generally in people's homes and thinking about potential risks that you may not kind of recognize. So for example, 2/3 of teens that misused pain relievers in the past year say they got them from friends and family, including in their home's medicine cabinets. So that just makes it all the more important to understand medication safety, including safe storage and disposal. And everyday over-the-counter medications, as well as prescriptions, can pose risks if they're not taken according to the instructions on the label or provided by the prescriber. And especially when medications are prescribed, we want people to recognize that they were prescribed to them like based on their medical history, their bodies, what other medications they're taking. So part of this is really encouraging people to not share medications. And I'll add last here that the campaign really encourages families too to keep maybe smaller amounts of certain items in their home. So the medications for sure, even things like Tylenol, like maybe don't go to Costco or Sam's Club and get the giant, hundreds of pills bottle. But beyond that, like not keeping a lot of chemicals and cleaners, but really kind of minimizing the amounts of those items in your home is a preventative measure for substance misuse and suicide.
Wow.
Okay, you also mentioned helping to prevent suicide by paying attention to things in our homes. How can we do that?
Yeah, so Justina was talking about that easy access to lethal means. That's a big piece of suicide prevention as well. When we're talking about those over-the-counter medications, like she was saying, the Tylenol and your Motrins, if you have a harmful amount of that available, that's obviously going to be more dangerous. So keeping those quantities limited. But a crucial strategy really in somebody that's having thoughts of suicide is reducing access to lethal means. That includes things like firearms.
Wow.
So do you have anything else to add about lethal means, since it's been a subject here a couple times? I guess almost anything can be a weapon, if you will.
Sure. So when we're talking about lethal means, those are the things that people have access to, that if they were to use them in a time of crisis when they're thinking about dying, that would actually result in death. We focus on firearms mostly with lethal means because that is a method that most of the time, majority of the time, will result in a fatal outcome if used.
Okay. And why don't we talk about also time and distance and how you define that?
Yeah, so suicidal thoughts oftentimes for some people can come on very, very quickly. And that's why it's so important when we talk about if you can put time and distance between somebody that's having thoughts of suicide and access to those lethal means, that can come on quickly. That can really save a life. Usually suicidal thoughts for most people are temporary. I mean, if you can get them help within that time, that chances are will go on and live a life where they're not thinking about suicide. So in that moment where that's, that crisis comes on and they're thinking about suicide, if they don't have access to whatever is nearby or in their home, chances are they won't go on to die by suicide. So really, that's why we talk about that safe storage in general is a huge piece of suicide prevention in our community.
Okay, you're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy, friends. Just a reminder to stop by the pharmacy and talk to a pharmacist about our new Health Matters Drugs Savings Program. We want to help you stay well and save money.
Okay, we're talking about Mental Health Awareness Month this morning. And before the break, we were talking about some means to help people who are struggling with thoughts of suicide. And I wondered locally if you had any statistics or comments on how common firearms are responsible for suicides in the area.
Yeah, it's a overwhelming number actually. Last year, so 2022, for our deaths here in Stark County, 78% of those were the result of a firearm. So I just want to stress that when we're talking about suicide prevention and all of the work that we're doing with the firearms community, it's not about, have a gun versus not have a gun. This is truly about safe storage and saving lives.
Gosh, that's amazing. I did recently, I had a friend who he took his life with a weapon. And it's very difficult for me to understand that. I know things are different in America and life is more stressful and but I just can't understand this at all. So go ahead. I'm sorry.
I was gonna say, I think it's hard for people to understand what goes through somebody's mind. And sometimes they think like they're being selfish, but truly when somebody is in so much what we call that psych ache, that deep emotional pain, they just feel like there's no way out and feeling like everybody else will be better off without them. So, we'll talk about this, but that piece of connection is just so important. And not having access to lethal means is another piece of that.
Yeah. So in terms of the safe home concept, we've been talking about what is the safest ways to store a gun?
So knowing that a suicidal crisis can come on very quickly, the absolute best way to store your gun or your firearm is to store your gun in one safe and then your ammunition separately. If you know that somebody is at risk and they have access to a gun, consider storing that gun for them. It's that concept of just like we take somebody's keys when they've been drinking. We hold on to their keys for a little bit. We don't let them drive. Same sort of concept, hold their guns. And just for that little bit, because that situation will likely improve pretty quickly as they're able to get help. Other pieces of that, part of it's you have to know why somebody has a firearm to know how to help them store it in a way that's going to be most meaningful for them too. Is there are things like trigger locks or cable locks, a safe. There's the biometric box. That's where you have it goes by your handprints, which are going to be probably more likely used by somebody that has that firearm for safety. You can also get a free gun lock for anybody that needs one at any of our local police departments. Some of our health departments are even starting to have those gun locks available as well.
Wow. I think we all want to keep a loved one safe, especially now that we have explained many ways we can do that. But how do we identify when someone's going through something unusual, or I don't know how to put that exactly, I guess.
Yeah, I can start with this in terms of like the substance misuse piece. I know especially with the safe home concept, we're probably looking a little bit more at like the youth teenage population. And it can be a little tricky probably to identify when they're going through something because just in general, there's a lot of different changes that they're experiencing that age between with mood and sleeping and even hobbies as they're kind of discovering themselves. But there are definitely behavioral, psychological, and physical signs that you can look out for. So like behaviorally, maybe looking for changes in friends, declining grades, increased secrecy about activities. Psychological signs can include lack of motivation, increased irritability, and unexplained anxiety. And physical signs, which people may be a little bit more familiar with, would be like the bloodshot eyes, changes in appetite, sudden weight loss or gain, or even just like unusual odors. But I also want to take a minute here and kind of point out that not all addictions necessarily have, especially those physical signs. So gambling addiction, for example, has some like behavioral signs to look for, but it's definitely more difficult to recognize. I like to use the example, if I had a problem with alcohol, I went out at lunch, had a couple of cocktails, you would know, right? I come back, I maybe, lack of coordination, slurring my words, etc. But with a gambling addiction, I can go out at lunch, blow a couple $1,000s, come back, and you likely wouldn't know that. So really it's kind of a hidden addiction sometimes.
Wow. So you mentioned betting. Sports betting is legal in Ohio now, I guess, frankly, just recently. Is that a new concern?
Yeah, so Ohio actually had the largest expansion of sports betting that any state has seen. While it's not necessarily like a new form of gambling, there's definitely increased concern about the number of people that could become at-risk gamblers. Like drugs, gambling can affect the brain's reward circuit by flooding by flooding the brain with dopamine. So surges of dopamine, kind of reinforce that as a pleasurable activity. And especially if people have big early wins, that can especially reinforce that. And just the fact that it's so easily accessible, like basically anytime, anywhere that you are, like you can just do it with so many different apps and websites just right on your phone. So the urge to engage in those kinds of activities is really difficult to ignore. And while gambling is not necessarily part of the Safe Home campaign, I do like to mention it because there is a pretty big tie-in with suicide and substance use. So those with gambling problems do have a higher risk of substance use and mental health issues, including thoughts of suicide.
Getting back to safe home concept, what's another key component of that?
Yeah, I would say a big component is recognizing the risks of alcohol in the home. According to local surveys, alcohol continues to be the most commonly used substance by youth in Stark County. We see that in the state, we see that across the country. And we just need to remember that, alcohol is so ingrained in our society and in our culture, but it can definitely pose a lot of risks, especially for youth whose brains are still developing and still growing. So we really want to encourage people back to like that small quantities piece is keep smaller quantities of alcohol in your home. If you have it, lock it up, kind of keep track of what you have available, and especially talking to your kids about the different risks that it can pose.
Wow.
I think that is an important concept because in the pharmacy, we get comments quite often from parents or caregivers that are a little shocked when they find out that one of their family members has been dipping into their medication. So we all think the best of all the people around us, and it's not to be naive, but it's just to be aware, right? So it's not to judge, just be aware. So if it can happen, it could. So it's something to be mindful about.
Always in my career, there's been at least in the last 20 or 30 years, there seems to be a lack of respect for prescription drugs. In the pharmacy, on occasion over the years, I would see Mrs. Jones talking to Mrs. Smith, and Mrs. Smith said, well, my blood pressure pills aren't working very good. And Mrs. Jones says, well, try some of mine. And she'd shake some out of the bottle and give her a few pills. And I'm thinking, this is nuts. And now we've gotten to the point in this country where we're trying about everything that's on the street. And with no fear, I guess, is what I'm reading or seeing. Is that correct?
I mean, I definitely would say that there's a lot of issues, I guess, but I think people just want to feel better. And I think there's also kind of a misconception about, hey, it's prescription, it's from a doctor, it's safe. And that's not necessarily true. Like kind of back to what I said in the beginning. I mean, it may be safe for some people, it may be appropriate for some people. It doesn't mean it's appropriate and safe for everyone. And I don't know that people recognize that.
And I would follow that up with, people think over-the-counter medications are safe because they're available without a prescription. So, and Tylenol may be the best example of that. You know, you need to be mindful of how to use the medication. So,
Absolutely.
Ladies, it's time for the news. It is the bottom of the hour. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You are listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Elena Aslanides, Kandis, and Justina Gorman with Stark County Mental Health and Addiction Recovery Board.
all right, ladies, what is the one thing you want to ask everyone to do today?
I would say to really educate yourself and talk to your kids. The Substance Abuse and Mental Health Services Administration, or SAMHSA, has a wonderful resource called Talk They Hear You that provides tips to parents and caregivers about how to talk to kids about alcohol and other drugs. So children are more likely to avoid drinking and substance use when they have a strong, trusting relationship with their parents. So really trying to get into the habit of making that part of everyday conversation will make it easier to have bigger, serious conversations later on, like with things about like alcohol and substance use, and really will encourage your children to be more comfortable coming to you for advice.
Okay, we talked about warning signs for substance abuse. What about warning signs for suicide?
We know this can be a really scary thing to think about, and a lot of times there are warning signs. Not always, but it's really good to know what to be looking for.
So what should we be looking for?
So, some of the most obvious things would be somebody that's actually talking about wanting to die. But then there's other things, if you know that somebody's just feeling a lot of guilt or shame, really feeling like they're a burden or hopelessness. That hopelessness is a big piece when people feel like there's no hope, or not having a reason to live. We talked about this earlier, but that emotional pain that we call psychache, when people just feel that that's unbearable, but also physical pain as well. When people have mental health conditions, that can put them at higher risk as well. Having access to lethal means, if somebody's giving away their prized possessions, and that one seems a little obvious, but you'd be surprised how many times we hear like after the fact of, maybe they were giving things away to the neighbor, and, not always making that connection. So just being aware and wanting to be able to check in. There are things like increased substance use. To really understand the warning signs more, I do encourage all of our listeners to take a training that's called QPR. It stands for Question, Persuade, and Refer. It's very similar to CPR, and that was intentional when Paul Quinnett created that training. It's kind of that version of, CPR. We all know that's for emergency first aid. This is emergency first aid for mental health. Specifically for suicide. So it teaches the warning signs, it teaches you how to intervene, When you're taking one of our local courses, it's teaching you kind of our local resources as well of what's available in our county to connect somebody to help. And you can look for these free trainings at starkmar.org. That's Stark, MHAR.org, and it's under our trainings and events section of our website.
I'm wondering if religion plays a part in this, in prevention and or maybe not prevention. Maybe
It does. Yeah. So faith-based, having that connection to some sort of spiritual power is definitely a protective factor for suicide. So if you know that somebody is very religious, and then all of a sudden they're starting to pull away from that religion, that's another warning sign to be thinking about. There could be times that it's the exact opposite. So sometimes people are not spiritual in nature, and then all of a sudden, as they're struggling with this, they're more interested in religion. So being aware of that as well.
And problems at their work site, or they don't like their job, or how often does that come into play in a discussion with somebody?
So here's the hard thing with suicide is that, when we know that somebody dies by suicide, most everyone wants to know why, what happened. And unfortunately, there's just not an easy one answer why. Usually when it comes to suicide, there are many things at play that go into what led somebody to that final act. It could be that there was just that one thing that was that tipping point. Maybe it was they got fired from their job or something that was that kind of that final impetus that caused them to take their life. However, usually there's many underlying things. That's why you have to be really intentional about knowing the warning signs. And when you see something is off that you're looking, but job loss, that financial security piece, if they have recently lost somebody, even if that's a perceived loss or if it's a death, especially if it's a suicide, those are all that would give us concern to be more concerned, or that would give us cause to be more concerned.
What about the responsibility of a boss or a supervisor or whatever? And the example that I want to show you is an individual told me that in the 30 years he worked for this one company, the boss never thanked him once. And that in coming to work for a new employer, the new employer was much different, thanked him for everything he did, and tried to make sure he knew what were the family issues, if there were some issues, if he came to work and wasn't in a very good mood. So what about this?
I think there's a lot of toolkits out there, especially now for employers, about how to address mental health. I think that is so important that you need to know your employees. I think it depends on each person. Everyone has a different style of what they need in a workplace. Some people, they're completely fine with going to work and leaving their job there. They don't want those relationships. Other people, they want that supportive environment. They need that validation. So yes, part of it is knowing your staff. But as an employer, I think we all have a responsibility, not just employers, every one of us, regardless of if you own a company or not, we all have a stake in reducing our suicide deaths. It's about saving lives. It's about caring for people. And so just human nature, be kind, check in, care. I think regardless of who you are and what your role is, we can all do that.
All bosses are preoccupied with many, many other things, but I really feel that they have to push that aside, and they have to recognize the issues with the staff and be, I guess, listen.
Yeah, I mean, it is. If somebody's struggling with something, I mean, having a supportive environment where you can get that support, it's only going to make them, more productive as well. So looking at it from that business lens, obviously that's important too. But I look at it from that human connection about we care about people.
So do both of you communicate with a lot of individuals in a daily basis, or I guess I don't know exactly how you perform your jobs.
So we work more what we call the macro level. So it's system level changes. So we don't provide any direct care at Starkmar. We provide funding to our behavioral health organizations that are providing the direct care. We provide oversight for those organizations as well, and just ensuring that good quality care is available within our system. Justina, do you want to add other pieces?
Well, I would say, even though we're not necessarily directly working with clients, we work with so many different community collaborators who all have a stake in these issues, and really trying to make sure our work touches the entire county through our different systems. We just work really hard to do that.
I think the good word is convener. Like we're a convener. Like we have, a few coalitions as well. Justina's got the Drug Free Stark County, that would be a task force. We also house the Suicide Prevention Coalition, which is what I house. And those are groups of people that they're not required to be on this coalition. They're there because they want to. Their passion, like Justina was talking about earlier, you feel that passion when you're in meetings. And so just being able to bring all of those people to the table to talk about how do we prevent suicide in Stark County and carry those things out.
And let people know they have a voice. I think that's so important, is, because these issues touch basically like all parts of our lives in one way or another, people should have a voice. And so we do invite community members to come to these meetings as well. We want people to know that they can share with us. And although change takes time, I know that's definitely a frustrating piece of our job, especially on that macro level, but we do take into account what people have to say and what feedback they have. I know both Elena and I have done different focus groups in addition to our regular coalition meetings to help solicit some of that feedback too.
Okay, very interesting. And it is time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy.
The Half Off and Out By store in Louisville is packed to the rafters with the usual and the unusual. We have everything here, including the kitchen sink. Great bargains are found in every aisle. Merchandise for kids, wives, and husbands. Something for everyone. Oh, more examples. Tools, wide assortment of kids' toys, Lionel trains, huge assortment of Mylar balloons. Helium is back for your party. National brands of readers and sunglasses, just for $1.69. Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy. The Medicine Center Pharmacies are now offering a service to help support your medication needs. We want to make sure that you have the medications you need when you need them. We will contact you 5 to 7 days in advance of your next medication refill to start the process each month. We will review your medications with you. We will contact your physician to initiate the process for refills and schedule a convenient day for pickup or home delivery. We simplify medication pickup into fewer pickups each month at the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Are you frustrated with the cost of prescription drugs? By now, you know that your insurance price isn't always the best price on your medication. The new Health Matters drug plan is a simple, easy way to save money at your local Medicine Center Pharmacy. No need to visit GoodRx or Single Care, disclose your private information, or print out coupons. Just talk to one of our friendly staff members and ask for the best price. It is that easy. Medicine Center Pharmacy with locations in Canton, Louisville, Minerva, and New Philadelphia, and online at medshoprx.com. socioeconomic.com.
You're listening to News Talk 1480 WHBC, Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
And let's get back to the last segment of the show.
Okay, we learned a lot today about paying more attention to things in our home and even things around us. Is there anything else that listeners should know, but maybe aren't thinking about?
Yeah, we have two resources that we definitely would like to share, but first I want to offer a challenge to all of our listeners. You know, we talked about checking in on someone that you know. So sometimes we think that, you know, everyone looks like they're going throughout life and they're like, we call them the strong friends, but I think we're all carrying something with us. So every day, I say every day, but especially since May is Mental Health Awareness Month, you know, just a phone call to somebody to say, hey, I was thinking about you, wanted to see how you're doing, sometimes can be more meaningful to somebody that we won't even realize. We won't know how that has impacted them. You know, I think about if you're in the workplace, you've got those times where you walk past somebody and you're like, hi, how are you? Like those aren't those meaningful because you keep on walking as you're saying good. But to really check in on somebody and say, hey, how are things going? How are you doing? Find somebody different every day to do that. We have been talking about that a lot, even at our coalition, the Stark County Suicide Prevention Coalition. And as some of our people are doing that, I've been able to get some of those text messages and can't tell you how much it means. It's like they know when you need that positive message or just that check-in to say, hey, I was thinking about you. So our first resource I will share, and then I'll turn it over to Justina to share her resource, but it's a phone number and it's 988. And for everybody that's listening, I want you to get out your phone and program that number into your phone. It's 988. 3 digits. It is very similar. It was intentional, was newly created, just like 911 is for physical emergencies. This is for anybody that's struggling with a mental health crisis, substance use, just needing that emotional support. I do want to put a caveat in there. If somebody has already started to attempt suicide or they have the means, they're right there, still call 911. But if you're just feeling down in the dumps, if you're just even thinking about suicide, if you're worried about somebody, call 988. It is the National Suicide and Crisis Lifeline number. It's available to everybody 24/7, but they really provide individuals with emotional support. I ask you to put that in there because you never know when either you might need that or you come across somebody that you don't know what to do, and you want to provide that number to them.
Wow, interesting. Now, who am I talking to when I call 988?
They're trained crisis counselors.
And it's immediate get to somebody, not a punch this number, this number, this number, this number to get to somebody else.
There's different, like if you press 988 and you press, there are some initial prompts, but you can get to somebody very, very quickly.
Okay. Interesting.
If you're a veteran, you know, you can press 1 and they've got some different supports because they're going to be more specialized into that area.
Okay. Interesting.
Well, I want to add some resources related to medication disposal. I think now is an especially great time to basically issue another challenge to have people clean out their medicine cabinets and get rid of unneeded, unwanted, expired medications in your home. So we do have 17 permanent drop boxes at our local police departments across the county. Many of them, I don't know if it's all of them, but are available 24/7. Go in, drop it off, no questions asked. And then we also have medication deactivation pouches from the doTERRA company. And we're actually going to be giving some to the Medicine Center Pharmacy. So they'll be available there for a limited time. So you can walk in, grab one for free. And they're really cool because you can put your medication in. There's a limit that's on the pouch. And you basically mix it with warm water, shake it up, and the medication is just deactivated. And you can just throw it away in your household trash. But like I said, I think now's a great time to really participate in that, especially with kids being home more for the summer. I know school will be out in a couple of weeks, but if they're out and around more and going to different people's houses, I think now's the great time to do that.
Wow.
I have I guess a question I'll throw out there. I don't know who wants to answer. I think any one of you three could answer, but this actually came up at the senior expo where we were about the medication disposal pouches. So many individuals would say things like, well, we can't just throw it away. Why not? So I think that's important for people to know the whys behind that if somebody wants to share.
I mean, I can share a couple of points from my perspective. I know if you just throw it away, you are leaving it potentially out there to be misused. I mean, people can find it, try to take it, depending on what mindset that they're in. And just environmentally, it can really affect, the groundwater supply. There are a few medications that I do believe say on the label, please flush, but we generally don't encourage that because of the water. And I'll add too that if you can't get to a drop box or don't have one of those doTERRA medication deactivation bags, in a pinch, you can absolutely at least mix whatever medication you have with used coffee grounds or kitty litter, and at least make it harder to get to in the household trash.
Interesting.
And, just as a follow-up to your comments there about that, we've seen some patients that maybe have a surgery or a broken arm and whatnot. And I think we have a lot of education going now for pain medicines and how to use them responsibly, to the point where some people maybe take a dose or two and feel they don't need them anymore, and then they just forget about that medicine. So those doTERRA bags are excellent for those patients that maybe have 10 hydrocodone left over and just forgot about it. And then they have the grandkids over, and you don't want to have something happen that you just didn't even see coming. So, but we've got just a couple minutes left. You've shared some excellent resources locally. Could you list your social media presence again and your website for more info for support for the public? And then if you have any parting comments you want to share just to wrap up, I think that it would be important to leave with our listeners.
Absolutely. So a couple of websites we do want to share is starkhelpcentral.com. That is a great place that you can just go. It kind of replaced the 211 that people were used to. It is a web, though. You have to get on the internet, but you can search for anything under starkhelpcentral.com. Our social media at StarkMar is starkmhar.org. Our Facebook page is facebook.com/StarkMHAR. And our coalition follows that same. It's facebook.com/Stark Suicide Prevention. So encourage everyone to get on there, share and like our posts.
Yeah, and so both of my groups also have one. So if you search for the Opiate Task Force of Stark County, so it's /Opiate Task Force Stark. And then Drug-Free Stark County. We do try to share a lot of helpful information on all of our Facebook pages.
Wow.
Very good. All right. Well, powerful messages today. I guess on a daily basis, I feel like we run into people in the pharmacy that maybe are lacking confidence or feeling a little hopeless. So just remember that on a day like today, the sun's out, you got air in your lungs. It's a good day. It may be a challenging day, but there's things to look forward to. So don't be so hard on yourself. Any other comments you ladies would like to leave with us before we wrap up?
Really just thank you again for having us and allowing us to share about this Safe Home campaign, especially during Mental Health Awareness Month. I think it's a great time to talk about it.
Wow.
I too just want to say thank you. And I also just a little plug, check in, have those conversations. Don't be afraid to ask somebody if they're having thoughts of suicide. It won't plant the idea. It's important. It helps reduce the anxiety and makes it known that it's okay to talk about.
Wow. Okay, ladies, thank you very much for participating today. It was very interesting. Elena Aslanides, Kandis, I'm very sorry.
Close.
Please school me, okay?
Yeah.
I'll come see you and you can school me. Okay. Community Response Coordinator and Justina Gorman. Coalition and Community Development Coordinator, both with Stark County Mental Health and Addiction Recovery Board. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, January Appraisals and Liquidations. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC. Thank you very much, ladies.
Thank you.
Thank you.
I've
Oh, that was
known too many people that have taken their life. So,
I'm sorry to hear that.
yeah,
Yeah. We all have a part in this. I truly believe that. So
yeah,
I appreciate you having us on air to talk about it. It's not a fun conversation for many people,
for
but
sure.
it's important.
But very enlightening and interesting, to
Yeah.
hear.
Yeah.
Just amazing. Thank you again.
Thank
Thanks,
you.
ladies.
Thank you.
Take care. Have a good day.
You too.